Pregnancy and yeast infection. Prior to discussing the complexity linking the chances of contracting Candida infections with pregnancy, we'll take a brief glance at the initial physiological reasons for the yeast infection ailment. However, the question still needs to be answered: does pregnancy make a woman's body even more at risk concerning yeast infections? Many women about to give birth are worried about this. The truth is that Candida infection is twice as probable during pregnancy compared to situations outside of pregnancy. Yeast infection in the vagina is characterized by thick, white vaginal discharge with the appearance of cottage cheese and discomfort while having sex. Almost 3/4 of women in Western nations will be afflicted by this kind of infection once in their lifetime, and many of them will have to continue enduring chronic Candida infections. As a matter of fact, candidiasis, or yeast infection, is a fungal infection appearing locally or systemically with particular impact on women in Western countries. The most frequent kind of yeast infection is vaginal infection, of which the typical symptoms include a burning feeling and itching, especially around the vaginal area. Candida exists to a greater or lesser degree in the intestinal and genital tracts of most people, but fungal overgrowth can bring on painful and debilitating consequences and also significant health complications. Yeast in this medical context means single-celled fungi. The common name, Candida, applies to the strain of fungi often seen in the human body under normal conditions as well. Different elements which may be internal, external, lifestyle-related or psychological then directly or indirectly form the context in which Candida multiplication comes about. As with many other medical problems, Candida overgrowth comes about because of group of factors and related interactions. In addition, emotional stress affecting many women when pregnant and while expecting a child may as a consequence degrade the immune system and increase the chance of yeast overgrowth. Pregnant women also often develop fixations on sugar-rich or white flour-containing foods. As traditionally, pregnant women are allowed, even pushed to obey such cravings, these sugars and refined carbohydrates increase even more the threat of yeast infection powered by these sugary environments. In pregnancy, a woman's body undergoes changes at several levels, including hormonal, physiological and psychological. These changes conspire to engender excessive Candida overgrowth and the accompanying symptoms. Pregnancy-induced hormonal changes modify the vaginal context and make fungi more likely to grow beyond acceptable limits. Ignoring candidiasis can lead to systemic yeast infection, with significant negative effects both in terms of quality of life and overall well-being. Since pregnant women may not use many of the antifungal medications or antibiotic treatments available to others, it is even more important to find another solution for candidiasis during this moment of childbearing. Finding a remedy for candidiasis in expecting women is crucial, because otherwise infection can be communicated from the mother to her baby through the birth canal during pregnancy or during childbirth, or afterwards via breastfeeding. The holistic approach, using modifications in dietary and lifestyle changes and eliminating toxins, can stop all types of yeast infection and also prevent their recurrence safely and effectively for pregnant women and the babies that they are carrying. Did you hear the news about the 100% natural holistic methods that can be used to remedy yeast infections permanently and safely? Pregnant women who want a complete and lasting answer to candidiasis can use holistic methods to rid themselves of this condition by taking a set of specific home remedies to relieve the symptoms and by using holistic all-natural guidelines that address the fundamental issues to tackle the real problem.